Read the first question.
A baby born at 6 months gestation is having trouble breathing.
Okay, it is related to which chapter? Respiratory. So what is the issue here? Okay. Okay. Next. You can sit. Lungs are properly. Lungs are not developed yet. Okay. Any other answers? So what will be the answer for your first question? Review questions for this. Only multiple choice questions we are discussing in this session. For others, you have to write the answer as assignment and come. Okay. What about the next question? If you can take a guess right now, that is more than enough. Okay. Next, read the second question. What did you understood by the question? I was about to ask the same question for you guys only. What do you mean by meconium? Esophageal fistula. Okay. Meconium means the newborn's first poop. That is called meconium. Okay. And there is no anal opening. So the poop can be seen in the vaginal area. So what is the condition? So what will be the condition? If there is no anal opening, what is that condition called? Rectum fistula. Okay, any other answers? Retrovaginal fistula. Okay. Vesicourethral. Fine. Any other answers? What do you mean by imperforated anus? I think I gave assignment, right? I just told write assignment on that topic and come. What type of birth defect does she have? So what type of defect is that? What type of defect is that in the second question? Fine. We'll go to the next question. Third question. Ask him.
When newborn baby was born with tracheoesophageal fistula, what is the most common type of TEF? Give the embryological basis of TEF.
So what do you mean by TEF? What exactly happens in tracheoesophageal fistula? What exactly happens in tracheoesophageal fistula?
When there is a blockage in the tracheoesophageal, when there is a blockage.
Okay. Any other answers?
TEF is not open.
Six. It's not open. Okay. It's not open or it is not separated? It is not separated. Usually your trachea and esophagus should get separated from each other, but in this condition we cannot see that separations. Okay. How many types are there? They asked what is the most common type. That means there are several other types also. So what are all the types of your TEF? How many types are there? And what is the embryological basis? What is that one structure that separates your esophagus and trachea? We have discussed it today also. What is that one structure that develops your trachea and esophagus from each other during the development? Epiglottis. Okay. Any other answers? Any other answers? Okay, we'll go to the next question. Next one. Fourth question. Read out the fourth question. Fourth, baby is born. Babies born after the 7th month of gestation usually survive, and why? It is related to which chapter? Respiratory. How? Sit. How it is related to respiratory system? Okay. Today, while discussing the development, I mentioned something as maturation of lungs, right? How many stages are there? How many stages are there? Am I not audible? There are 4 stages in the maturation of your lungs. What are those? If you see the first question, it is mentioned the baby born at 6 months is having difficulty in the breathing, but during the 7th month, if the baby is born, it is going to survive. How? Still in 6 months, it has some trouble in breathing, but in the 7th month, if the baby is born, it is going to development of alveoli buds. And any other answers? Stop talking. Next question is, why newborn baby develops cyanosis? That is, the face becomes blue when he or she cries. It is related to which chapter again? Cardiovascular system. Okay. The septum between two not developed. Okay. That how come the septum development is leading to the face blue color? Next question. Read the question. Okay. What you understood? I don't want to answer. What you understood by the question? She has already read the question. What you have understood by that question? Oh, fine, right. So what is the embryological basis for this condition and what that condition is called? I think for you two only, right? I asked to show the epigastric region in the class for you and him. I told you both of you to get up and asked you, no, not now, sit down, and asked you both to show the epigastric region. In which class? What we are discussing that day? Development of urinary system. If we are discussing urinary system, why I'll ask you to show the epigastric region? GIT. So which part? Foregut, midgut or hindgut? Midgut. Okay. Is it right? Is it anything related to your midgut abnormality or congenital disease? Proximal part of duodenum? Okay. Any other answers? Do you remember I showed one X-ray in that class and I told there is a gap like bubble-like structure. What is that condition called? Duodenal atresia. Yeah. Next question. What is the embryology? You can sit. What is the embryological basis for the second question? The loops of the intestine will not return to the abdominal cavity. They will remain in your umbilical or outside the abdominal cavity, and later after the birth they will, through the umbilical cord, they will expose into the outer part. Any answers? Others? Any answers? It is related to which chapter? Respiratory distress. Okay. What is respiratory distress? Can you please repeat? We have deficiency of surfactant. Okay. There we have mentioned the baby soon becomes cyanotic. What do you mean by cyanotic? Okay. For the same, for this question, she mentioned something from your cardiovascular, right? So how come here we are discussing about the respiratory and not cardiac part? In the last question, for this question, she answered something related to your CVS, right? There will be the absence of septum, something you mentioned, right? But in this case, we are discussing about the respiratory system. Why not the cardiovascular system? Okay, there is difficulty in the breathing. Okay, fine. Any other answers? You can sit. You can sit and answer. What will be the embryological basis if there is a surfactant problem? What is not developed? Alveolar. Okay. Alveolar ducts, alveoli buds. What is not developed? What is the embryological basis for this particular condition? What do you mean by the lump in Grayon? Few days back, she noticed a lump in Grayon of her child. What do you mean by that? No idea. There is a clue. She noticed a lump in the Grayon region, and later there is one more clue: congenital indirect inguinal hernia. And they also added one more question: mention whether or not congenital indirect inguinal hernia can occur in females. Okay, what is the difference between direct hernia and indirect hernia? What are the different types of hernia we can see? What is the difference between direct and indirect hernias? You are searching that question. Later you search and write the assignment. That's why I said I'll give it as an assignment. You all have to answer and come. At that time you discuss with your friends. Search it and write. Now you discuss with me. What is the difference between direct and indirect hernia? Okay, at least in which chapter we'll study about the hernia? Did I ever discuss anything related to hernia in my classes? No? Okay. Others? In which chapter you all studied about the hernia? In which chapter? Inguinal ligament chapter. Okay, fine. So what do you mean by hernia at least? Protrusion of the abdominal. Okay. Then how we are classifying direct and indirect hernia? What are the different types of hernia we can see? Femoral hernia is there, right? Any other hernia you know? Umbilical hernia, okay. And inguinal hernia, okay. Femoral hernia, I said that already. Any other hernia? How the hernia will be diagnosed? Like in general, how we can diagnose the hernia? How we can treat the hernia? If you go to doctor and you will say that you have hernia, how they will treat you? What is the common approach? Medicine, okay. Medicine, they'll give medicine, obviously. Okay. Any other answers? Okay. As you grow, laparoscopy, fine. Any other answers? Okay, at least in this question it is related to which chapter? The first question which we are discussing right now. Inguinal part. Okay. But I didn't do that classes, right? I have covered only the respiratory, CVS, GIT and urogenital, right? Urogenital. Okay, fine. We'll go to the next question. Okay, it is related to which chapter? What did you understood by the question at least? Tracheoesophageal. How?
Because when she tried to make weight to swallow the food, it's choking in there is a eating region.
Okay.
That's why I think the trachea and esophagus are not divided. The local stomach is also.
Okay.
When the doctor tried to put the tube, it's not getting inside.
Okay. Can you please read the last line? When inquired about. No, can you please read from there?
When inquired about an empirical history was found about to be a case of polyhydramnios.
So what do you mean by polyhydramnios? What about others? Excess of amniotic fluid. Okay. So if there is excess amount of amniotic fluid, what is going to happen? What you said is right. Okay. But they have added one more word there, polyhydramnios. So we have to think about that also, right? So I'm asking one more question, guys. What is going to happen if there is excess of your amniotic fluid? Give the embryological explanation for the given figure. First you just explain what can you see in that figure. Okay. Okay, so which chapter it is related? Sit. So which chapter it is related? This question, aortic arches. How? Okay, what is wrong in that picture at least? What is wrong in that picture? There are two aortic arches, okay. But so in general we see how many aortic arches? Only one aortic arches. Which side? Which side? Right side or left side? Okay, so basically this is your double aortic arch condition. If you remember, I have given assignment question for double IVC also. I have written only the name and I said write assignment for double IVC, and that day only I mentioned both double aortic arch and double IVC are important clinical conditions. Okay, figure out the problem later. So what will be the embryological basis if it is a double aortic arch condition? From which aortic arch you are, from the which pharyngeal aortic arch the right aortic arch will develop? There are 6 pharyngeal aortic arches, right? Few will retain and few will disappear, and we have remnants also. So from which part your right aortic arch or left aortic arch will appear? Fifth. Right side or left side of fifth aortic arch? Left. No, you all write the answers and come, then I'll discuss once again. Next condition. What you have understood by the question? What you have understood by that question? At least seeing the picture, can you identify any condition? Gravida. Okay. Gravida means like this is her third baby. This is the third time she is delivering. For that we use the word gravida. Gravida means like, yeah, she is third time pregnant, or this is the third time she is delivering the baby, like that. She is delivering the baby for the third time. It's not like she is pregnant for the third time. There are some cases where there may be abortion or miscarriage also. If she is delivering, for that we use the word gravida. So here it is clear she is 30-year-old woman who is delivering for the third time. Okay. It's not like she is pregnant for the third time. She is delivering the baby for the third time. This is her third child and it is dead. So what will be the condition, or at least what you have understood by the question? Okay. 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 What do you mean by scoliosis? Vertebral column? You mentioned something spinal cord, right? So scoliosis means it is not S-shaped. Okay. What is your answer? I can't hear you seriously. Okay, lateral bending of the vertebral column, fine. And what about the other two conditions, clubfoot and meningocele? Clubfoot is discussed? No. Lower limb is completed. Lower limb is completed, right? But they haven't discussed the clubfoot. Arches of foot is not finished. Okay, fine. The other one condition? Meningocele. What do you mean by meningocele? Any idea? Okay, for which chapter it is related at least? Forget about the clubfoot and meningocele and some other condition. Whatever the chapters which I have discussed, among that, for which chapter it is related? GIT. Okay, where you can see the problem in GIT here? Okay, fine. How you will relate it to the given question? Okay, here the question is very clear. They are asking you to observe the figure, whatever they have given, both A and B, and there are multiple conditions. They are asking you to discuss about those conditions with the embryological explanation. Okay, for this question you can write answer only which I have discussed. You can skip the other parts, no problem. But if it is given in your exam, you have to address all the problems. But for your assignment purpose, I am telling only write about these two conditions. Okay. Next.
Babies born at 6 months of gestation develop respiratory distress syndrome and inhibits neurological disease.
Any idea about respiratory distress syndrome? Okay. Okay. That's it. Okay. Others? Any answers? Okay, this is related to your respiratory system, but I haven't completed the anomalies part, okay? So in the next session, I'll first discuss the anomalies part and then we'll see the question of that, okay? If you know answer, if you can attempt, well and good, try it. Otherwise, no problem. Next question. Next question. In preterm. Any idea about that? Okay, go for the next question. Silence others. Can it be like you are in doubt and you are asking? Okay, fine. Okay. What made you think that it might be the esophageal atresia? Last. Any answers or any guess? Any guess at least? For the last question. At least what you guys understood by that question? All three of you. gas present in the stomach. Okay. What about you? What you have understood by the question? Write your assignment answers and come. I'll share the detailed answer again to your CR. He will circulate. Check it. Compare your answers with my answers. If you have any doubt, you can come back to me. We can discuss. Okay. This is again related to your respiratory system, but here they have clearly mentioned the baby was born at the 26th week. So what will be the condition? Lungs not developed. Okay, fine. Is there any particular name for that condition? Respiratory distress. Okay, fine. How this baby can be treated to avoid the mortality? They have added one more question that is related to the diagnosis of the baby. So any idea how we can treat the baby? Can you see that question? How this baby can be treated to avoid the mortality? How we can be treated the baby here? The baby is already born. It is having difficulty. It is not dead yet. It is just having the difficulty in the breathing. So how we can save the baby here? What about the next question? The newborn infant lung is denser than the adults. Why? What is the embryological basis for this condition? Or what will be the name for that particular condition where the newborn baby lungs are denser comparatively to the adults? What is that condition is called? Any idea about that? We'll go to the next question. Yes, it is possible. Abnormal condition. This is abnormal condition.